I had a really interesting question from a friend the other day who heard me use the term reversible dementia and was a little confused by that because she's seen, as maybe we all have, a lot of really unreputable people claiming, we can reverse Alzheimer's disease and, you know, you can get better. And so she had this reaction to that, like, well, what do you mean reversible? And that's a medical term. So when we talk about reversible versus irreversible dementia, the first thing to kind of get our hands around is that dementia is a collection of symptoms. So that by itself is not a disease. Alzheimer's disease is the manifestation of those symptoms because of a certain cause. Okay, so dementia itself is just confusion, losing track of memory, losing track of space, time, and having that difficulty orienting oneself within the environs. So that can be caused by a lot of different things, not just Alzheimer's disease. So some kinds are reversible and some kinds are irreversible. Alzheimer's disease functions in that irreversible category, where something like a urinary tract infection would be in the reversible category. So reversible stuff that's something that can be fixed. So maybe I changed a medication, or maybe I'm really depressed. Maybe I get heat stroke. Something happens in my body that kind of affects that body-brain connection in a way that throws it all off, but it doesn't actually permanently, as long as we treat it, damage the brain. Now, something like Alzheimer's disease or strokes or traumatic brain injury or abuse of alcohol and drugs, those permanently change the brain. They actually damage the brain in a way that at this point in our medical understanding, we can't recover from. So it's kind of like the difference between let's say you break your finger and we can repair that. But let's say we, actually lose a finger, well, then that's gone and we can't fix that. So that's sort of like the difference. Can we repair it or can't we? Currently, in our medical understanding, we can't repair something like Alzheimer's disease. We can't reverse that trajectory because the actual brain is damaged in that process. And the same thing with, traumatic brain injuries and other things that damage the brain permanently.